hierarchy of controls. Used alongside risk assessment, the World Health Organization's hierarchy of controls provides a framework for reducing the risks of sharps injury. Starting with the most effective action and moving down the hierarchy to less effective controls, the hierarchy highlights the most effective way of controlling these risks. If it is not possible to eliminate the risk, then a combination of the other steps should be employed. 1. Elimination of hazards. 2. Engineering controls. 3. Administrative controls. 4. Work practice controls. 5. Personal protective equipment. We'll now cover each control for sharps in a little more detail. Hierarchy 1. The elimination of hazards. Complete removal of sharps from the workplace is the most effective way to control the hazard or needlesticks, so this should be done whenever possible. Ask yourself if it is absolutely necessary to carry out the procedure. If it is, can the use of sharps be avoided, or is there an alternative? Examples of eliminating the hazards include removing sharps and needles when possible. For example, use needle-free connectors. Eliminating unnecessary injections. For example, provide medicine orally when possible. Eliminating unnecessary sharps. For example, a urine sample doesn't require needles and can on occasion provide a better biomarker than blood. Obviously, sharps cannot always be avoided. In this case, move to hierarchy 2. Engineering controls. 2. Engineering controls. In reality, it will be difficult, if not impossible, to eliminate all sharps from work environments. So the next step is to use engineering controls to limit the risk of injury. Many medical devices now incorporate sharps prevention mechanisms. These are an example of engineering controls that reduce the risk of a needlestick injury. They include safety-shielded and retractable needles, safety lancets, blunt needles, for example, for suturing, needle-free systems. Further examples of engineering controls include adequate numbers of easily accessible sharp disposal containers, and a well-designed work environment, for example, good lighting and adequate space for staff. Thirdly, use administrative controls to further reduce the chance of sharps injuries. Risk assessments will inform which administrative controls are appropriate. Examples of administrative controls include information and training, clearly defining the health and safety responsibilities of all staff, adequately resourcing safety arrangements. Writing a sharps policy that details exposure prevention plans, as well as follow-up actions should exposure occur. Promotion of a no-blame culture. Having incident reporting procedures in place. Conducting accident investigations following an exposure so lessons can be learned. Fourth in the hierarchy of controls are work practice controls. These controls aim to change the behavior of workers to reduce exposure to occupational hazards. Examples of work practice controls include never recap or resheath needles, because resheathing needles is a common cause of needlestick injury. Using only approved sharps containers. Placing sharps containers at eye level and within arm's reach. Disposing of sharps immediately after use in designated sharps containers. Sealing and discarding sharps containers when they are 3/4 full. Establishing means for the safe handling and disposal of sharps devices before the beginning of a procedure. The fifth and last control when everything else has been done is personal protective equipment or PPE. PPE provide barriers and filters between the worker and the hazard. They will prevent exposures to blood splashes, but will not prevent needlestick injuries. The main PPE to reduce the chance of an occupational exposure are gloves, but eye goggles and masks may also be appropriate in certain circumstances. Although a needle or sharp instrument can easily penetrate a latex glove, there is evidence that gloves can reduce the risk of infection, and double gloving further reduces the risk of blood-borne virus transmission from a sharps injury.